right now. Hello, everyone. Thanks for joining us. I almost said TED Talk, but this isn't a TED Talk. Anyway, we are doing hypertension, and let's get started. Okay, so during this video, our objectives for you guys is that students will know what blood pressure is. You will also know the normal and hypertensive range of a blood pressure, and you'll also learn about the risk factors associated with blood pressure and how to prevent it. So let's start with what is blood pressure. Blood pressure is the measurement of the pressure of blood against the artery wall. And that's going to consist of your systolic and diastolic measures, which we've already learned about. So the systolic is going to be the top number, right, which is the measurement of pressure in the artery wall after the left ventricle contracts. And then the diastolic is the resting period. So the normal range of a blood pressure is going to be anywhere between 120/80 to, well, that's the normal range of a blood pressure. You don't want it really anything above the hypertensive state, which is going to be 140/90. So again, the normal range, we like 120/80. The hypertensive range is going to be 140/90. And that's per the American Heart Guidelines versus the Joint National Committee. So there's a couple of different sets of numbers. We went with the American Heart Guidelines, which you can see on our references page. What is hypertension? Hypertension is the higher than your normal blood pressure range. So anything over your range is considered high blood pressure. The causes of this could be a sedentary lifestyle, so lack of exercise, an unhealthy diet. Your genetics play a huge role into it, as well as your alcohol and tobacco use. Your signs and symptoms. So when you have really high blood pressure, unfortunately, it's not one of those things that you can just detect unless you take your blood pressure. So it can come in forms of confusion. You can get a really bad headache. Some people experience blurred vision. More serious, kind of rarer things to happen would be your blood in your urine, chest pain, shortness of breath, and arrhythmia. So again, an irregular heartbeat. How to manage hypertension. Your lifestyle, getting adequate exercise. So 30 minutes of cardio exercise a day, a good diet, and you're going to the doctor once a year, and knowing your family history and doing those early screenings.
Risk associated with hypertension. As mentioned, hypertension occurs when blood flow resistance increases as it's pumped through the arteries, then increasing the pressure on the walls of the arteries. This damages the artery, like the walls of the arteries, and in this weakened state and under high pressure, the arteries can bulge, causing an aneurysm. With the arteries being affected like this, it increases the resistance of blood flow, which then increases the strain on the heart as it has to work harder to pump blood throughout the body. And this can cause problems like coronary artery disease, enlarged left heart, and heart failure. The heart isn't the only organ that experiences this strain though. As the blood supply is restricted, organs aren't receiving the necessary oxygen and nutrients, impacting their ability to function, which then affects organs like the brain, and this can cause transient ischemic attacks, stroke, mild cognitive impairment, and other things from hypertension. And then the kidneys can also be affected, working as like a filtration system of the blood flow. So when that's impacted, then the kidney's ability to function is impacted.
Hypertension screening. So the U.S. Preventative Task Force recommends that screening starts at the age of 18 for hypertension with the associated risk. In order to get the initial diagnosis of hypertension, you need to get a series of doctor's offices blood pressure measurements, meaning that you go to a doctor's office in a setting and you get a series of blood pressures. Who should be screened? Anyone above the age of 40, anyone between the age of 18 and 39 with the following factors: obesity, African American, Hispanic, anybody usually have a high normal blood pressure that's around 130 to 139 systolic or 80 to 89 diastolic. There are different types of screenings. There's mass screening, where healthy individuals who are at risk. There's target screening, screen specific groups of people considered to be higher risk of hypertension than the general population. And then opportunist screening, which screen individuals with expected risk when they are engaged with the health system or another environment where screening may be offered.
Okay, so some education recommendations. Preventative measures for hypertension include maintaining a healthy diet. So this could look like having all the food groups present, eating a good amount of vegetables and protein. Cheat days are okay, so like don't go crazy with dieting. They say like everything in moderation. Make it doable and reasonable and something that you can keep up on. People always go on these crazy diets and then they just drop off eating healthy altogether. Getting in daily physical activity is really important. This helps maintain your healthy weight and keep your blood pressure at levels normal. Another one is don't smoke. We all know smoking is bad. This isn't the 1920s. Keeping alcohol consumption at a reasonable level will also help with prevention, as will managing your stress levels and getting enough sleep. So high blood pressure is very manageable and treatable, and a lot of medications can help too, especially for older adults. I know this is like difficult to get like a lot of sleep as nursing students, but if we manage our time well, it'll help us lower our stress and give us enough time to get more sleep. So we're not much help to others if we die of hypertension before we become nurses. And there's our reference page.